You're listening to an extract of the Leader podcast. You can find us wherever you listen to your podcasts. So 1 year on from the start of lockdown, where are we? Has it worked? Is the vaccination programme a success? Are fewer people catching and dying from coronavirus? Our Deputy Political Editor Nicholas Cecil's here. Nicholas, what are the latest figures for London?
Case numbers have been going down for months now in London. And interesting, this morning, the latest figures showed that the 7-day rate for the age group 60 and over has now gone below 20 confirmed new infections per 100,000 people a week. The reason why this is important is that this age group are the people who are far more likely to suffer severe disease from COVID, to be hospitalised, and also very sadly to die. So if case levels are getting this low, it means that the impact of the disease is going to be far less.
Which all sounds very positive news, and we of course have this roadmap to come out of lockdown ahead of us, but the public health bosses in London are urging us to just keep going, aren't they? Just get over this final hurdle before lockdown ends.
Yes, this was Professor Kevin Fenton, who's the London Director for Public Health England. He's highlighting that the figures are going in the right way, and it looks like the relaxation of lockdown will probably carry on given the data. And for example, in Hackney, in the City of London, the 7-day rate is now down to 15.5. For the capital as a whole, it's 36.5. But there's some boroughs where it is still noticeably higher. For example, the highest at the moment is Hillingdon at 74.6. And also, I think Boris Johnson in coming weeks may face some difficult decisions because there's increasing disparity between some regions about the infection levels. For example, if you look at Yorkshire and the Humber, the rate there is nearly 110, 109.1, which is 3 times the rate in London and the South East, which very much leaves the question open: can you lift the restrictions on a national basis when the disease levels are so different?
And then we also have this third wave that the continent is experiencing. Germany has just extended its lockdown restrictions because of a rise in infections there. Boris Johnson has admitted that the third wave is likely to end up on these shores too. Is that a big concern for the UK right now?
The experts say that yes, there is likely to be a surge in cases this summer, but that this is unlikely to be similar to the first and second wave. The reason for this is that Britain has really had a world-leading vaccination programme. Already we've seen more than 28 million people get a first dose jab and over 2 million get a second dose inoculation. Professor Callum Semple from Liverpool University, he was stressing this morning that if we can win this race to get people vaccinated before this third wave hits our shores, then you're going to be seeing far fewer deaths, far fewer hospitalisations and severe cases of the disease. So if that is possible, then it means that you can keep the economy and society far more open than previous times where there've had to be strict lockdowns to stop the disease spiralling even further out of control.